Hey everyone, and welcome to Attentive Healthcare Solutions webinar, The Importance of the Social Determinants of Health. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. And let me just say, I am super excited about this webinar today. But before we get into it, I want to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy in the slides and the recording within the next week. Next, for those of you who aren't familiar with Attentive, I wanted to share a bit of who we are with you. We specialize specifically in next-gen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen, and we also have some add-on productivity solutions for next-gen, ChartGuard, and Refund Manager. Next, I wanted to mention an upcoming educational webinar that we'll be presenting on May 22nd, Next-Gen Utilities, the best-kept secrets to make your life easier. In that webinar, we'll showcase the various next-gen utilities that are available to clients to make their lives easier. These utilities automate various jobs and processes like file maintenance configuration, PM workflows, faxing documents, and patient engagement to improve performance, effectiveness, and security in your next-gen environment. We'll be sending out an invitation to that in a few weeks, so keep your eyes peeled for it. Okay, so back to today's webinar on the social determinants of health. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce the presenters for today. Lindsay Lanning is Manager of Client Development, and Cindy Kincaid is Vice President of Client Solutions at Attentive. So Lindsay, the webinar is all yours. Feel free to get started when you're ready.
Great. Well, thank you, Chelsea, and welcome to everyone here on the line to our webinar today, highlighting the importance of social determinants of health. We usually try and come up with some pretty witty and eye-catching titles for these things, but when it came time to think of a title for this topic, there really wasn't anything witty or eye-catching or attention-grabbing we wanted to say or could think of. And not for lack of trying, it was because we couldn't find the words that adequately expressed the importance of social determinants of health in today's world and the future of healthcare. So there you have it. We kept it pretty simple for you for the sole reason that this topic is so important. And it's true, with such a strong correlation today between socioeconomic status and health outcomes in the current healthcare environment, it's important to begin looking at how social determinants of health affect your patient population. Taking the steps to improve healthcare for all individuals is a top priority and focus for healthcare leaders in our country, and we want to make sure your practice is aware of what's going on in the industry surrounding this topic. So in this educational webinar, we want to inform and provide insight on what social determinants of health are, factors that affect an individual's health outcomes, different initiatives taken to close the gap of socioeconomic differences, and of course, why it is all important for healthcare entities today to recognize this correlation between social determinants of health and the outcomes in your own practices. So we know this topic has always been a priority, but recently there's definitely been an increased drive over the years, but even more so over the past few months to identify and acknowledge the social determinants of health and actually enhance care using this knowledge. So throughout the presentation today, we will provide you with the tools you need to prepare your practice to focus on population health and what to expect in both the short and long-term future when it comes to this industry-wide change revolving around the importance of these determinants. So let's go ahead and get started. Starting with the basics. What are social determinants of health? And social determinants of health are the economic and social conditions that influence individuals and determine a difference in health status. Basically, they are the conditions that people are born, grow, work, live, and age in. They are really that wider set of forces and systems shaping the conditions of daily life for a person. And if you look at the graphic provided, you can see where social determinants of health fit in with this idea of health equity. And first off, health equity is actually the state in which everyone has the opportunity to attain full health potential, and no one is disadvantaged from achieving this because of social position or any other socially defined circumstances. In simpler words, it's the state where everyone has a fair shot at living the healthiest life possible. So we want to take a look at and understand how these factors or social determinants of health actually impact a person's health and how they're being incorporated into our healthcare arena today. So I went over how we decided on our title for this webinar, that we truly believe it's so important. We didn't even have the desire to dress it up. We just wanted to convey its importance to you. But who are we to tell you how important social determinants of health are? We are just a small IT consulting company. Why should you believe what we have to say on this? So I thought I might bring in some names you may recognize in case you needed a little convincing right off the bat. So first up is a quote from Karen DeSalvo, who served as Acting Assistant Secretary for Health at the U.S. Department of Health and Human Services in the Obama administration from 2014 to 2017. She also served as the National Coordinator for Health IT from 2014 to 2016, where she set national strategy and policy on health IT. She said most health outcomes are not determined or remediated within the healthcare system, meaning these outcomes are determined by outside factors. I would say, personally, Karen DeSalvo is social determinants of health's biggest champion in the industry right now. I have quotes and initiatives she has started throughout this presentation, so I wanted to give you a little bit of her background right off the bat. And to follow up with a quote from a recently published report, the Center for Healthcare Strategy states, although 95% of healthcare is devoted to direct medical services, roughly 50% of preventable deaths are attributable to non-medical indicators such as social circumstances, environmental factors, and individual behaviors. 50%. And if you still aren't convinced, let's look at some statistics released by the Robert Wood Johnson Foundation. They're the nation's largest public health philanthropy. And after an in-depth research, they estimate that only 20% of health outcomes can be attributed to clinical care. 20%. That means the other 80% are accounted for by upstream social determinants of health, including social and economic factors for 40%, physical environment at 10%, and health behaviors at 30%. Can you believe that? Medical care is estimated to account for only 20% of the modifiable contributors to healthy outcomes for population. The other 80% are all health-related behaviors, socioeconomic factors, and environmental factors. Now, the first time I ever heard this statistic was actually at the HIMSS annual conference keynote opening session this past February. Not shocking, Karen DeSalvo actually recited it on stage, and it truly made my jaw drop. From someone who is constantly working with clients and practices on quality measures under MIPS, CPC+, ACOs, and even working with ASCs now, and other quality programs, all of those depend on outcome-based measures. For all of those practices, there is this other component that accounts for well over 50% of their performance that is not only out of their control, but completely off their radar because they aren't collecting data or asking these questions on social determinants of health as a part of traditional care right now. Now, you can see looking at this graphic, the interaction between health outcomes, social determinants of health, and policies and programs in place at the system level. And you can see just how little access and quality of care play a role in someone's overall health compared to their health behaviors and social and economic factors. To put this in an example for you, if we look at tobacco, it is a leading determinant of many health outcomes. Think of quality of life, life expectancy, or morality. And decreasing tobacco use is actually more influenced by the price of cigarettes and smoke-free environments in that person's community than it is by the availability of cessation clinics or cessation screening or quit lines. Now, on the last slide, you heard me specify upstream determinants, and that those upstream determinants account for 80% of health outcomes. So I wanted to take a look at what we mean by upstream versus downstream. Public health in general has notoriously focused on the downstream factors you see on the right side of this graphic, like disease and injury and mortality, and even risk factors that we all know we screen for on a daily basis and we document in our EHR. So smoking use or tobacco use, alcohol and drug use, etc. But what social determinants of health and the shifting healthcare landscape is having us do is focus on more of those upstream factors that determine health. We know in today's value-based care environment, organizations are accountable for actually improving health outcomes and lowering costs. So to achieve these goals and succeed in that environment, organizations need to better understand their patients and address those upstream socioeconomic factors that are going to impact your patients' behaviors, costs, and outcomes. So those social determinants of health, or what we commonly refer to as the conditions people live, work, play, and age in, can encompass things like environmental conditions, institutional power, and even social networks. These factors exist upstream in that they occur and interrelate with each other to ultimately influence the characteristics that actually manifest further downstreams that we're used to looking at and measuring, such as health conditions, health outcomes, and those behaviors. Now, the traditional ways of identifying complex patients right now is grounded in the downstream medical model in terms of when we look at number of chronic conditions, health outcomes, and even hospital or emergency department utilization and visits. Because the social determinants influence these downstream factors, the industry is actually shifting to include them in how providers identify and treat complex patients. Care teams are finally realizing they must have an understanding of their patient's complexity, clinically and non-clinically, in order to make informed care decisions that are going to be patient-centered and also provide interventions that are more appropriate and tailored to that patient. So kind of as a recap here, downstream refers to your typical clinical care factors such as health conditions, risk behaviors, and diseases, whereas upstream refers to things like socioeconomic conditions, institutional power, environmental conditions, and your social context. So as an industry, we're seeing that shift from downstream focus to upstream. So now that we have the basics of social determinants of health down, including what they are and where they fall on this upstream-downstream continuum of care, let's look at the factors. So as I mentioned before, social determinants of health are best described as where someone is born, live, work, and play. And these include things like public safety, your access to transportation, exposure to crime, violence, any other kind of social disorder. It also includes their access to media and things as simple as sidewalks, roads, and buildings. These all play a part in a patient's overall health in some way. So let's look at the 5 key areas identified by the industry as the foundation of these determinants. We have economic stability, education, social community context, health and healthcare, and lastly, neighborhood or your built environment. Let's take a deeper dive into each one of these and see what it all encompasses. First is economic stability. Economic stability is going to depend on things like employment, not just if you have a job, but what kind of work you do. If you have exposure to chemicals in your line of work, such as lead, maybe pesticides or asbestos, these are low quality environmental conditions. Or for instance, certain stressors, let's say you actually work an evening shift or double shifts, maybe you have multiple jobs or extended hours. These can also be a factor and lead to things like depression or risk of mortality. Maybe you have a labor-intensive job. That also applies. We also have food insecurity. Health outcomes that are increased due to food insecurity are obesity, chronic diseases, and developmental problems in kids. This makes sense if you aren't getting the nutrients you need and fast food is your only affordable option. Housing instability. Housing instability doesn't just include not having a home or being homeless. It includes trouble paying rent, overcrowding, moving constantly, having to stay with relatives, or even having to spend the majority of your income on housing. Some kind of health outcomes that we've identified from housing instability are very similar to the ones we saw with food insecurity, with obesity, chronic disease, and developmental problems in children. It makes sense if you don't have a home to cook a meal in or a bed to sleep on, these things are going to have adverse effects on your health. Poverty. Residents in impoverished neighborhoods or communities are at increased risk for mental illness, chronic disease, higher mortality, and lower life expectancy. And we can see from the graphic, low-income households that can afford housing are actually able to spend 1/3 more on healthy food and 5 times as much on healthcare. So overall, obtaining a job determines your economic status and determines resources available to you. Being able to afford basic living requirements such as housing and food and transportation definitely has an impact on your health and your healthcare access. Next is education. Education is considered at all levels. First, it's early childhood education and development. Stressors such as abuse, family instability, unsafe neighborhoods, and environmental hazards can all cause cognitive developmental delays in children. High school graduation. Obtaining an education will actually lower health disparities and secure employment to sustain a steady income to ensure housing and food stability and safe living conditions. Enrollment in higher education. Studies are coming out now that show students with parents who are involved in their schooling are less likely to drop out, and kids who do end up dropping out have a higher rate of poor health and premature death. And then lastly, language and literacy. The result of limited English proficiency is lower quality healthcare. That could be due to inadequate interpretation services or interpreters actually omitting or normalizing different pathological information that would have helped the patient better understand their healthcare situation. So while we're aware education is important, have you ever actually taken a step back to look at how it actually impacts your health? There is a strong correlation of higher education to higher health literacy, which means understanding medical issues, being able to read prescription labels and understand them, and also comprehending any patient education that your provider might give you, which is all imperative to overall health and your health outcomes. The next factor is actually social community context, and while there are a lot that plays into this, some of the main components identified by Healthy People 2020 report to actually focus on are these three: civic participation, incarceration, and social cohesion. So civic participation, that has a correlation to actually increased physical activity and an increased sense of purpose and belonging, which positively impacts health. Incarcerated individuals have a history of mental illness or higher risk for high blood pressure, asthma, cancer, even arthritis, and HIV and AIDS. And on the flip side of that, children of incarcerated parents often have higher rates of learning disabilities, speech or language problems, attention disorders, and even show aggressive behaviors. And finally, social cohesion. Social ties, or even the lack of social ties, can transmit negative health behaviors. Social isolation is actually a very common social cohesion issue right now among older adults that can lead to insomnia, loneliness, and a lack of support. So overall, this key area focuses on life situations that can alter your mental or physical health, increase chronic conditions, and impact the development process for children. Next, we have health and healthcare, which includes access to healthcare and primary care as well. And then we also have this idea of health literacy showing up here as well. So first is access to healthcare. Lack of health insurance coverage is probably one of the largest barriers to health access due to the fact that out-of-pocket costs can be extremely expensive, resulting in individuals either delaying or declining necessary treatment or care. And then we have access to primary care. With access to a primary care provider, an individual is much more likely to do things like receive the flu vaccine, go for blood pressure screening, as well as cancer screenings. But since we're seeing a lack of health insurance coverage or transportation barriers and the lack of the ability to take off time from work to go actually see the doctor, all of these are acting as barriers to primary care access. And lastly, health literacy. Health literacy is what allows the individual to take charge and responsibility of their health care. That includes the things I mentioned before, like being able to read and understand prescription labels, knowing how to schedule your doctor's appointments, and understanding the recommendations provided to you from a clinician. So we all know and can definitely agree access to healthcare determines your care and your treatment outcomes, as well as the resources that are available to you to uphold disease management. If you don't have access to care, it's much more likely that you're going to have health problems that in the long run could worsen or lead to different complications or even death. And then lastly is neighborhood and built environment. This determinant focuses on things like access to food that actually supports healthy eating patterns. Healthy eating can lower risk of high blood pressure, diabetes, and cancer. So think neighborhoods that have less access to fresh produce and more access to fast food run a higher risk of obesity and diabetes. If you have a farmer's market that's on your street corner every Sunday, you're much more likely to purchase those items than if you don't. Crime and violence. Children exposed to violence experience behavioral problems, depression, anxiety, sometimes PTSD. They have a higher risk of substance abuse. They show risky sexual behavior and even unsafe driving behavior. Environmental conditions. Air pollution is a big one. This can increase cardiovascular disease, lung cancer, and even lead to death. Specifically, pregnant women, infants, and children are most vulnerable to air pollution. And then we have quality of housing. Aspects that contribute to the quality of housing includes, again, that air quality, but also home safety, space per individual, how many people you have in a house, presence of mold, asbestos, and lead as well. So the takeaway here is that environmental conditions can increase chances of multiple negative health outcomes. Air quality, exposure to heat or chemicals, violence, and even access to healthy food all play a part in determining someone's long-term health. So how do these factors actually affect health outcomes? We provided some examples, but at a high level, these social determinants of health influence an individual's risk of developing certain chronic conditions and can lead to health complications if an individual does not have adequate access to healthcare, transportation, education, different resources, etc. And you might have noticed social determinants of health often overlap and can very easily become interdependent on each other. And all of these depend on each other to affect the person's overall health, which we saw going through some examples, showing us that social determinants of health are not mutually exclusive. Meaning if you have factors such as low income, that could lead to housing instability, and that goes right along with maybe an unsafe neighborhood or a lack of health insurance or a lack of healthy food being distributed at where you are right now. All of these factors depend on one another and they are interrelated. So let's start looking at what's happening right now to close this gap and actually strive for health equity. But before we look at what initiatives are taking place, I wanted to answer the why question. We've answered the what question. What are social determinants of health? We've answered the how question. How do these impact care? But why? Why? First off, focusing on the best outcomes with the lowest cost. That is the definition of value right there. High quality and low cost. That is the goal for everyone right now. Not only that, but if providers can get ahead of the risks associated with social determinants, then providers are able to have more meaningful conversations with patients about the challenges they're facing. We always talk about the patient experience and being able to form a relationship with our patient that is meaningful and valuable. This information facilitates that. No matter what patient population you serve, these factors do impact your patients to varying degrees. And lastly, closing the gap allows for necessary screening, chronic disease management, and preventative measures to be taken to avoid illness or the illness is getting worse. So again, taking this proactive approach versus reactive and focusing on preventative measures. I mean, if social determinants really are controlling 80% of a person's overall health, this to me seems like a no-brainer. It should be tracked and included in a patient's chart. So while there have been many efforts to close the gap between economic status and resources available so that social determinants of health don't actually hinder anyone's health, there are a few we want to specifically mention. These include ride-sharing services, health-focused education, affordable housing, and even food delivery services. So the first initiative, which is probably drawing the most attention lately, is ride-sharing services. Ride-sharing services have not only increased with our millennial population lately, they've also increased in the healthcare sector. Did you know 3.6 million individuals do not access medical care because they experience transportation barriers? And 4% of all children miss a medical appointment because of transportation issues? To that same effect, transportation barriers are the third leading cause of missing appointments for seniors as well. So to close that gap of transportation barriers, Lyft has actually partnered with Circulation to offer rides for non-emergency care. Humana also collaborated with Lyft in this same fashion. They just actually announced that within the past few weeks. And then Uber just recently announced it was entering the healthcare sector last week as well. So since transportation is a significant factor of social determinants, ride-sharing services can actually work to improve patients' access to care. And I think we're going to see a lot more agreements and collaborations coming out with, like we've seen with Humana and Lyft, in this same fashion. So we all know obtaining a good quality education leads to job opportunities, which then leads to proper living situations and access to healthcare. So education is clearly a foundational factor to health outcomes. But we also mentioned health literacy as a key part of education. So as a result, hospitals are actually conducting community health needs assessments at schools to understand what healthcare topics should be covered for kids to gain a better understanding of health. So for example, Fillmore Community Hospital actually partnered with their public school district and realized kids were struggling with mental and behavioral health. A pilot program was integrated within the school district, and as a result, students demonstrated healthier social skills and a willingness to proactively manage behavioral issues. So implementing health education programs set kids up to be successful in actually managing their own health as they get older. These types of programs lead to individuals understanding their health, being able to engage with providers, and actually being able to advocate for themselves as patients. This type of education definitely lays the foundation for making healthy decisions that will actually decrease their chances of chronic conditions and diseases in the future. So we're seeing a lot more, again, of these partnerships and education programs popping up at that lower age, that early childhood development in different schools. Next is affordable housing initiatives. Housing developments are being built for individuals in poverty to improve living conditions. They're trying to decrease the risk of lead paint, asbestos, and other environmental factors that are present in some homes. But what we're looking at is not only just your affordable housing going up, but we're also seeing public safety in these housing developments being considered. This is a newer focus by including additional police officers, fire departments, and even public sanitation to provide a clean environment and reduce drug-related crimes or violence or even trash buildup. These housing developments have even expanded even more and taken it a step further in the past few years to make sure they include things like gym facilities, after-school programs, recreational spaces, as well as food pantry support and even putting health clinics in. So you can see how this initiative bridges the gap of social determinants by offering an improved amount of resources through housing developments that are going to actually assist in improving the overall health of individuals. And then lastly are the food delivery services. So just one example here is Blue Cross Blue Shield. They actually launched a healthy food delivery service called Food Q. Its goal is to improve the diets of individuals that live in areas lacking fresh food, like fruits and vegetables. So that goal is really to help bring more awareness to the foods that should be eaten regularly by making healthy food more readily available. So we can see providing services like the ones mentioned before that address adverse social determinants of health will actually work to help organizations successfully participate in this value-based environment and achieve the goals outlined in the quadruple aim, which guide our industry right now. And those are better health, lower cost, and not only an improved patient experience, but an improved clinician experience as well. However, we are well aware the current system does not adequately incentivize addressing these determinants. They do not ensure these services are sustainable or cultivate community partnerships necessary for approaching health holistically. But what you may not be aware of is how the industry is moving in that direction. This past month has been filled with announcement after announcement highlighting social determinants of health. Honestly, it seems to me ever since Karen DeSalvo shined a light on this issue at the HIMSS annual conference, it has set in motion a movement to support the capture of this data that cannot be stopped. So I will actually hand it over to Cindy to go over some of the most recent events that show how the industry is reacting and where we see the future heading. So Cindy, it is all yours.
Okay, thank you, Lindsay. All right, as you can tell, we're pretty passionate about all of this information. It's something that we, as an organization at Unintended, feel strongly about. Lindsay and myself in particular are really trying to stay focused on this and understand how it's changing and how it is impacting. And we want to bring that to you, so we hope we're sharing that with you. And another quote from Karen is that what we're learning more about in the last 2 years is how social determinants of health affect healthcare costs, utilization, and more concrete healthcare outcomes. I think it's obvious. Things like readmissions to the hospital, all of those areas, if you take the time to read this particular quote, sums it up pretty accurately. It is important and it has an impact. And in addition to what I feel is just obvious information, we also know that the industry is catching up with value-based, going over volume-based, and all of the things that are changing. We can see this coming into the forefront. So let's talk about the value-based care models. New value-based payment models, such as alternative payment models, ACOs, patient-centered medical homes, Medicare shared savings programs, they're all moving toward payment for outcomes rather than process measures. And they're also looking to benchmark total cost of care. Since better results on the social determinant of health are associated with better health outcomes, payment models will evolve to jointly reward healthcare organizations and communities for outcomes such as lower tobacco, obesity, diabetes prevalence, or improved high school graduation rates. Yes, CPC Plus is already requires practices to assess health-related social needs using Health IT. So let's take a look at the ACO, or an Accountable Health Community model. CMS also launched Accountable Health Community modules. This is the first model to include social determinants of health. This model is based on emerging evidence that shows addressing the health-related social needs through enhanced clinical community links can improve health outcomes and reduce costs. If you take a look at the timeline, May 1st, this is really 2017, participant performance period begins. April 30th, 2022, anticipated participant performance period end date. So they're going to be looking at this over a period of time. And if you take a look at some of the articles, particularly the CMS blog, and then also addressing social determinants of health will help achieve health equity. This article in CMS blog was sent out on 5/2/19 in the official news from Medicare Learning Newsletter Center. I'm not sure how many of you have seen it. We touched on it in our newsletters as well, and we will probably be doing some blogging on this to further add to the information. But it basically states that data collection will help CMS strengthen our understanding of the relationship between social determinants of health and healthcare uses across diverse populations. This will allow us to develop solutions and better connect patients to much-needed services. I'm going to take this a little further on something we're not covering too much in this webinar, but I'm working with a couple of clients who have encountered medical legal partnerships, and that's allowing them to bring their underserved patient population information on how to help themselves by introducing legal assistance on top of having the medical assistance. They're actually having attorneys in the practices on certain days. So, for example, you have a patient who's living in substandard housing, and they bring their children in, and the children are being treated for asthma, but they're going back to a home infested with mold. There's no treatment going to help unless they can take care of the problem that's in their environment. So that's the type of thing that we're seeing more and more coming out in addition to these areas. And yes, they are leaning towards being able to add coding for this. So United Healthcare and American Medical, and the AMA announced last month is expanding the ICD-10 diagnosis code set to include social determinants of health. This is just last month. They've added several Z codes, and the proposal is to add 23 more codes on top of the existing codes that have already been added. The codes have been broad, so the additional codes are going to be more specific, so that will include things, inability to pay for prescriptions, inadequate social interactions, or fears about losing housing, just what we were kind of touching on. So all of these codes are kind of coinciding with the enhancements that are being brought to the healthcare arena. Medicare Advantage and Part D are also jumping on board. Also announced in April, the Centers for Medicare and Medicaid Services now allow Medicare Advantage and Part D plans to offer supplemental benefits to address the social determinants of health. And starting in 2020, the benefits will include these meal deliveries, rides to the grocery store, or services that make patients' home environments conducive to healthy living. All these benefits are in the hope to positively impact the patient's health in the long run. Just think about it. The patients will actually be able to have benefits that will allow them to be able to take care of themselves in a much better fashion. They're recognizing that in the end, this is going to improve costs by paying for some of these services that will allow patients to access they need. Humana, their 2019 Bold Gold program. Bold Gold progress report released by Humana examines the company's own progress in improving results among some of its Medicare Advantage members. So again, they're looking at the Medicare, but a Medicare Advantage member who is food insecure can have up to 26.6 unhealthy days a month, correlating to $15.64 per month in higher medical costs. Just look at the notice on the article of April 26th. Given the current demographic trends, they expect to see continued demand for a support structure that addresses these social needs along with the clinical ones. They go hand in hand. You can't do one without the other. So now let's take a look at data framework and screening tools. Obviously, if you're going to be doing this, you have to have tools that will allow you to help this. The data frameworks have been proposed for integrating social determinants of health into primary care and capturing domains in the electronic health records. Screening tools have been developed and models are emerging on how to follow up for this screening data. Clinic to community treatment models for children living in food insecure households, for example. We have accountable healthcare communities related social needs screening tools, health lead screen tools, and the Prepare tool. Yes, it's not a spelling error, it is a tool, Prepare, or Prepare as it's pronounced. So we're going to focus on the Prepare. The protocol is basically the protocol for responding to and assessing patient assets, risks, and experiences, acronym Prepare. And it's a national effort to help health centers and other providers collect the data they need to better understand and then act on their patient social determinants of health. If you take a look at this graphic, Prepare is a standardized patient social risk assessment tool. It consists of national core measures. These include to define and document the increased complexity of patients, to better target clinical care, enable private providers to demonstrate the value they bring to patients, communities, and payers, and to advocate for the change at the community and national levels. By using Prepare, providers can better target clinical and non-clinical care. They can work to drive care transformation and the delivery of system integration, as well as improve the health and cost reduction. The Prepare assessment tool consists of a set of core measures and optional measures. It does align with the national incentives prioritizing the social determinants of health. And as you can see, it looks at the Institute of Medicine's recommendations, Healthy People 2020 goals, measures proposed under the next stage of the meaningful use, clinical coding under ICD-10 codes, and health centers' current federal information reporting. So all of these things are being considered, and it all is understanding that this is going to be looking at this and allowing you to document and treat this information and analyze it. It talks about the personal characteristics, family and home, money and resources, social and emotional health, and other measures that are associated with the Prepare initiative. We've got an example of the Prepare assessment tool. It's an assessment tool. It's a two-page form of 21 yes and no questions of social determinants that indirectly affect an individual's health. It is designed to be a predictor for poor health outcomes, and providers will be able to better target clinical and non-clinical care as a result. Prepare measures are mapped to ICD-10 Z codes, LOINC codes, and SNOMED codes to further standardize data for aggregation and analysis. Many of the Prepare EHR templates automatically map to the ICD-10 Z codes so that they can easily be added to the diagnostic and problem list. So let's talk a little bit about NextGen and Prepare. We haven't really focused on NextGen too much in this webinar because we're talking about social determinants of health and it's new for everyone. But NextGen did work with NACHC to develop a set of templates for use of the Prepare program. They are available on the Success community. We have worked with clients to integrate them, and we have done some customizations for them in various regions and states, particularly Texas, based on some changes that they wanted. But overall, the templates are there, and they're very helpful. And NextGen may eventually develop a KBM integrated version of these templates. For now, they're only the NACH PCS version, but they're so it shows what's recommendation, and that's where we come in and modify them occasionally. You really don't have to do that to get it started, though, and I suggest everyone, if you're interested, make sure that you have these if you don't have them already. Here's an example of the prepared template. It's not a very clear screenshot. It's just designed to give you an example of what it looks like and how you could have it in your template selections. And then this is just the template opened up and exploded and showing you the different areas. So you can see basically how it's broken out. So now as we move on to NextGen Analytics, many of you have seen and talked about NextGen Analytics. I'm sure you've heard about it. NextGen is very, very excited about this, and it is really focusing on being able to look at population health and campaigns and being able to monitor your patients. While they have not integrated prepared data into this, the plans are to incorporate it, and it may be integrated soon. We don't know the date. So how do population health, public health, and social determinants of health go together? I'm going to turn it back over to Lindsay, because she can take over here and bring us home in this.
Perfect. Well, thank you, Cindy. As you can see, all of these announcements happening in what seemed like, at least to me, who's constantly looking at industry news, back to back to back order over the last month. To say, it kind of gave me the pat on the back here, really solidified our desire to put on this webinar months before these even came out, but to keep you all informed on where we see this industry heading. So for our last few slides, I want to talk about how population health, public health, and social determinants of health fit hand in hand. Hence, the very purposeful slide graphic we have here. We have seen a sharp increase in population health technology adoption in the past decade. Looking at NextGen Analytics, how that has come out and increased sharply in popularity and use. And it's really only gotten stronger as the shift to value-based care continues, and we see more and more payment arrangements and contracts depend on quality and cost. Like I said, we talked about NextGen Analytics, the Pop Health solution for NextGen, incorporating the PREPARE standards for social determinants of health. So those will be actual buttons that you can filter your patient population by. And I think more and more population health tools will actually do the same. These truly do go together when we talk about looking at the whole picture of health for patients while at the same time driving value for your practice. So let's look at what each of these terms mean and how they intersect to put us where we are today. The purpose that population health is concerned with is both the definition of and measurement of health outcomes and the pattern of these determinants. Public health, on the other hand, can be defined as what we as a society do collectively to assure the conditions in which people can be healthy. So population health focuses on understanding the conditions and factors that actually influence the health of populations over lifetimes. It also measures the patterns of occurrences of certain problems and implements policies for the overall health and well-being. Now, the point where these three intersect is where we see the future of healthcare delivery in a value-based world. Gaining a view into your patient population has become essential for transitioning from volume-based to value-based reimbursement. An accurate understanding of your population helps determine which patients have the greatest need for outreach and intervention, and how best to actually allocate your practice's resources. Identifying and stratifying patients at and near risk within your population is key to managing care, controlling your costs, and improving patient outcomes. So a data-based clinical strategy leads to increased revenue and better opportunities for growth under value-based payment models. And that strategy, that data-based clinical strategy, now includes social determinants of health and add to the overall goal of public health. To reinforce this idea of overlap, we have an initiative that started in 2016, but has gained more support recently, which is the Public Health 3.0 initiative. In 2016, the U.S. Department of Health and Human Services launched the Public Health 3.0 initiative. This initiative stresses improving the health of all people in America and address social factors outside of healthcare. They released an announcement saying doing so means we must build on past successes and work across sectors to get closer to the essential definition of public health. Basically, this renewed approach to public health incorporates social determinants of health. And you won't be surprised, one of the main champions of this initiative and speakers on this is, again, Karen DeSalvo. But what this does is it really refers to a new era of enhanced and broadened public health practice that's going beyond traditional public health department functions and programs. It uses social determinants of health as guiding principles, so every person and every organization can actually take shared accountability to ensure the conditions in which everyone can be healthy. So you can see where this started, using that graphic as Public Health 1.0 and Public Health 2.0, going back all the way to the late 1800s. And then when it transitioned to 3.0, right around when the Affordable Care Act came into play. And you can see the progression with the buckets in the graphic next to it, from traditional clinical prevention, where you're increasing the use of evidence-based services, to where we are currently, I think, hovering right now in that innovative clinical prevention, where we are working to provide services outside the clinical setting and focused on those other determinants of health. And then lastly, where we're headed, total population or community-wide prevention. So implementing interventions that reach whole populations. And as a government spokesperson said, Public Health 3.0 recognizes that we need to focus on the social determinants of health in order to create lasting improvements for the health of everyone in America. Public health is what we do together as a society to ensure the conditions in which everyone can be healthy. We often think the healthcare industry when we think health, but building healthy communities requires strategic collaboration across all sectors. When we build a complete infrastructure of healthy communities, we can begin to close the gaps in health. So I think it's safe to say, or I hope, we're all convinced and well aware this movement to capture social determinants of health and begin tracking and recording this data is here. It has arrived. But there are still some unanswered questions and some things we still need to learn about. And I didn't want to overlook those. So number one, how do we prioritize social determinants of health for individual patients and for communities? We know prioritization requires an assessment of readiness to actually address these proven or testable interventions. Practices are also concerned with return on investment. So we need to realize and prioritize which patients will benefit the most from addressing their social determinants of health. And for that matter, which social determinants of health? Which patients are most ready for these interventions? Which interventions will decrease per capita spending? From a community perspective, which social determinants of health are of most concern to community stakeholders? And which social determinants of health will have the greatest effect on total population health and well-being, as well as health equity and actually lowering healthcare expenditures? So that first question, that unknown of prioritization. Number two, how do we intervene without medicalizing social determinants of health? There is a danger that a medical approach to these non-medical factors will lead to more healthcare versus more cost-effective and community-based interventions. How do we listen to communities? How do we identify and define healthcare's role and collaborate appropriately with existing community resources and increase capacity? The third question, what social determinants of health data should be collected? For what purpose and by whom? I will default here to Niall Brennan. He was actually the former Chief Data Officer at CMS. And he asked how social determinants of health data fared on 4 key questions. He says he always asks about collecting any type of new data. So he asked, number 1, how much will it cost to collect? Essentially asking, is the juice worth the squeeze? 2 was, how good is the data and is it standardized? His third question was, how comprehensive is the data? Are we getting it for 5%, 10%, 50%, or 100% of people? And then his last question was, what level of granularity does the data need to be at? These questions lead us back to the issues of prioritization, the opportunity index, and of course, effective interventions. So with so many unknowns about the use of these determinants in clinical care, having data for measurement and evaluation of these interventions is essential. Monitoring for unintended consequences, for even the most well-intentioned programs and policies is important, because we don't want to have a negative effect. We want to ensure that disparities do not actually worsen by collecting this data. Question 4, how do we build multi-sector partnerships? What partnerships should be built to address the determinants of health for individuals and for communities? What sectors need to be involved to achieve these desired outcomes? What are the roles of people and organizations in these different partnerships? Building these multi-sector partnerships requires trust for not only, and here's a big one, sharing data, but also for sharing resources and money. We've seen this start to happen, for instance, with Humana partnering with Lyft, but will we see more, and how? And the last question is, what else? What have we not considered? What else do we need to know to truly incorporate this data and information into care today? With the failure of our current healthcare system to deliver better health outcomes at an affordable cost, exploring opportunities using these other determinants seems wise, if not imperative. We do know that. This movement or shift, I guess you'd say, to track social determinants of health for patients really is only getting stronger day by day, with continued support at a very high level. Even if you aren't seeing patients who are suffering from some of these risk factors, such as low income or unstable housing or unsafe neighborhoods, you might be wondering, well, how does this impact me in my practice and my patient population? Well, the impact will be having to track this data moving forward. It's only a matter of time before this becomes mandatory under some of the payment models. I mean, we're already seeing it pop up in these value-based care models that CMS is releasing, even in the CPC Plus program. And we also need the data to support the flip side of things. We need the data that living in a safe area with access to quality food and advanced education does in fact support good health outcomes. So the last question really becomes not if, but when will collecting data on social determinants of health be incorporated into our current workflows? And are you prepared? And no, that is not a typo. If you know me at all, you know I can never pass up a good pun. So I'm sorry, I couldn't resist, everyone. But with that question in mind, we can look at next steps. If you're uncertain where your practice stands, if you're interested in tracking this data, or you want to learn more about where the industry is heading with more evidence-based practice on where this is going, we can help through a variety of ways. We can provide recommendations on how to include this data with your patients and in your workflow, assess your current readiness and your current practice state, and even help you implement these new processes or procedures. If you are interested at all, or you want to learn just more about us and Unintended in general, please go to our website, unintended.com. Continue to sign up for these webinars. We have a lot of great topics coming up in the next few weeks and months. Also, go ahead and visit our blog. We do have one of those coming out in the next few weeks. We have some 3-day fixed price on-site consultations, and of course, test drive our products. We have made it to questions. Just wanted to thank everyone for joining us today. I'm going to go ahead and turn it back over to Chelsea for any questions that you guys have on the call right now. But our contact information is up there as well if you wanted to reach out as well. So Chelsea, all you.
Great. Thank you so much, Lindsay, and thank you, Cindy. Thanks everyone for joining us. Again, if you have questions, you can type them in the questions area of the webinar control panel. We only have one, so if you have them, you have time to answer them, so just type them in. So the current question is, what if we don't serve an underserved population? Does this still affect us?
I can grab that, and I kind of mentioned that here in the last few slides. And I've gotten that response a lot when I've been talking to other provider partners and things like provider partners as well as different team members and things like that. But it's true, it does. Number one, I think is obvious that, well, if this becomes mandatory that you have to track the data, that's going to impact your current workflow. But not only that, we need the data too on the other side to prove that if your patient population isn't suffering from any of those adverse social determinants of health. So if they do have good access to healthcare, they do have access to healthier food, they don't have any signs of housing instability, things like that, those are showing better health outcomes. We also have some practices, I'm sure, that maybe they think their patient population isn't suffering from any of these adverse social determinants of health. And the truth is, you never know until you ask. So I would encourage you to if this was mandatory or anything like that, to look at that and see how it could impact your patient population that you might not even be aware of.
Great. Looks like we have another question. What version of NextGen do you have to be on to get the prepare template that was shown?
This is Cindy. I'll try to take that. I don't believe you have to be on 5.9 because one of our clients, the first one that we ever installed was well over a couple of years ago, and they were not on 5.9 at the time. I think it works better, and some of the new enhancements are there. So I think when I say 5.9.8.4, and everybody should be moving to that anyway, I would just check with in the success community and compare it to your version. I don't want to speak that it works with every version, but I do not believe you have to be on the current version.
Yep, if
Great,
you go into the success community and just search prepare, I think it's the first link will come up with some more information on that.
Thanks, ladies. Another question. Where are most practices incorporating the prepare questionnaire into their workflows?
Groups that I'll take that one as well. The groups that I have worked with, and to be honest, it's only been 3 that I've been involved with that have used the prepare template, and they've all been in Texas. The groups that I have worked with are you incorporating it as part of the intake when they're doing the my mind, terrible thing to waste. When you're doing the the nutritional assessment, the depression screening, all of your screening tools, that's typically the flow that they're putting it into, is in that same line of thought.
Okay, thanks, Cindy. Well, it looks like that might be all the questions that we have, but I want to thank everybody for joining us, and if you think of questions after the fact, you see both Cindy and Lindsay's information on the screen, so feel free to reach out to either of them, or you can always reply back to my email when I send out a link to the recording and the slides. And thanks for joining us, and we look forward to hopefully seeing you at our next upcoming webinar, which, as a reminder, again, is on May 22nd, and that one's going to cover next-gen utilities, the best-kept secrets to make your life easier. So thanks, everyone, and have a great day, and thanks for joining us.
Thank you, everybody.
Thank you.